I've watched medicine since 1974 go from my being in a solo practice, only person between Hatteras and Currituck, and I've seen great things happen, particularly the advent of the hospital and what it's brought to our community. The hospital is probably one of the two major elements in a community that produce growth and quality in the community. Without a hospital, people wouldn't come here.
The Outer Banks Hospital opened its doors on March 19th of 2002. That was really a landmark day in our area because it offered individuals some relief from the extensive travel for health care. Since that time, services at the hospital have grown and continue to grow because our community is always at the forefront of any initiative at the Outer Banks Hospital. In fact, it was the driving force in the recent decision to form the Outer Banks Medical Group. This is a group that consists of 9 physician practices, 5 primary care, and 4 specialty practices, which stretch over 60 miles on the Outer Banks and includes over 100 employees, including more than 35 providers. As the group is being formed, you may have noticed some new signage for these practices that reflect the Outer Banks Hospital brand. We have purposefully aligned those 9 practices with the hospital to provide a more connected continuum of care and further enhance the quality of the patient experience.
Our patients love the community feel, they love the facilities at the hospital, and it's been nice to keep them closer to home.
We're able to provide continuity for them, not just for their medical needs, but for them as people, and that's what I think is really important.
Having 2 surgeons here for the Outer Banks Hospital is great for the community because they don't have to go off the island to get care. They can stay here and have their treatment done here locally, and Outer Banks Hospital is a wonderful facility.
The medical group, providers, and staff have truly embraced the connection. Not only does the close proximity to the hospital provide a sense of family for everyone, but the hospital and the practices utilize the same electronic medical record. This shared connection, along with MyChart, allows the patient and providers to more easily, accurately, and securely access information and collaborate on the patient's plan of care.
For years I was in a private practice and we had paper charts and everything was great, but nobody has one doctor anymore. So even when you go over to the hospital, you'll be meeting another team. We're all interconnected, and I was just on the phone with a professor up at UNC for one of my other patients, and we've been connecting through the MyChart. And you know, as we live out here in the Outer Banks, we have to know what we do what we do as well as we can. And when patients need something that we don't have or do, just get them where they need to be, and don't lose any time, energy, money, or any of the information that makes your care seamless.
It's a wonderful working relationship since I've been on board for the past 7 months. The support that I get here from the administration at the hospital and also from the medical staff at the hospital has been absolutely wonderful. Certainly for physicians, we identify maybe a little bit more, even though we know we're tied to the hospital, but having the sign that says Outer Banks kind of gives us a sense of family in the medical community.
So far, the change to Outer Banks Medical Group has been very good because it's kept us more local. I know they were going for a regional feel before, but we're kind of isolated here on this island, so affiliating with the hospital has been great.
The camaraderie with the people down at the Outer Banks Hospital has been wonderful. Everybody has been excited to have us here, as well as we are excited to be here.
The Outer Banks Hospital is the epicenter for care on the Outer Banks, and now, rather than us trying to identify ourselves with a medical center that's in Greenville, that's 3 hours away, now it's, you know, we're represented by the folks in our own backyard. It's a little comforting. You know, the hospital's got our back, and I think that's important to know. And I think that a united front brings a culture that I think is good for the community.
Physicians that are here now are just fantastic. The ones that are attached to Outer Banks Medical Group are all people that you can trust and that believe in their role in this community.